Hello, it's Dr. Rhonda Johnson, and today is Monday, July 11th, 2022. Today I'm talking about BA5 symptoms. My message today comes reports from infected people and other clinicians, as well as some articles online. Now, from my combined information sources, there are some novel symptoms of presumed BA5 Omicron COVID infection that appear to be a little different than previous variants. Why do I say presumed? Because, again, most people don't know what variant that they get infected with because you don't get those results back when you get your tests. So some of these new symptoms are neck pain or painful stiff neck, light sensitivity that shows up as dislike of bright lights, brain fog, that's difficulty concentrating and difficulty focusing, and numbness of your extremities. Could be your arms, or it could be your legs or your feet. Now, these symptoms can mimic spinal meningitis, so please be checked out by a doctor if you are experiencing them, folks. In combination with other Omicron symptoms such as high fever and headache and fatigue, and you may even have a sore throat, sneezing, runny nose, although some doctors are saying that they're seeing BA5 patients present with painful sinus congestion and more severe sore throat pain. So again, this virus can cause a whole host of symptoms, and you may not have all of them, you may have some. So, according to the CDC, the time that it takes to get from infection to symptoms, the time, incubation period after exposure, is shorter. It can be as little as 2 to 3 days for this BA5 variant. Now, folks, don't count on thinking you won't get this virus because you're vaccinated and boosted, or because you had previous infection and think you have natural immunity. Why? Because this variant is resistant to antibodies from both previous natural infection and vaccination-induced immunity. Now, anyone who has been in contact with someone who is COVID positive is advised to get tested 72 hours after exposure. Now, keep in mind that your home rapid test may not be positive at first. It may not be positive until day 5, according to some experts, because this variant may not be highly concentrated in the nose like previous Omicron variants and subvariants. Now, reminder also, if your rapid test is positive, you have the virus. But if it's negative and you have symptoms, you could still have the virus and the test not show it yet. The PCR test remains the gold standard. Now, this is an emerging disease in the United States, and we can't always predict what's going to happen here based upon what happens in South Africa or Europe or Israel, because health is local and there's a lot of demographic variables between these populations. Also, people are getting reinfected with BA5 because, again, the immunity doesn't hold up and this virus can escape immune protective pathways. So people are getting reinfected within 4 weeks of a previous COVID infection, folks. Listen, this virus is not taking a vacation this summer. Mask up. If you don't want to get infected, go back to your non-pharmaceutical interventions. Wear that mask when you're indoors and outdoors if you're in crowded places. And get the high-quality mask. Maintain your hand hygiene. Start now. Don't wait for the CDC to tell you you have high levels of community transmission, because you may already be infected. That is my message today. As always, my views are my own. I hope that you'll stay safe and be well. Take care.